Welcome again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Eon and joined once again by Dr. Clifford Yudelman from OptiSmile, ready to take a deep dive into the world of dental care from a consumer's perspective. Whether you're looking to brighten your smile or protect your wallet, we've got you covered with practical advice and the latest insights. So stick around with us for the next couple of minutes as we uncover the secrets to maintaining both your dental health and also your finances, very importantly. Dr. Clifford Yudelman, welcome back once again.
Thanks for having me back. I hope you had a nice relaxing week, and if you went to the dentist, you found our tips from last week came in handy, like breathing through your nose and telling the dentist how poop scared you are, things like that. And before we kick off today, I've had a whole week to think about the name of that movie that I mentioned where the guy gets tortured. And I'm not sure if you've ever seen it. I don't recommend it because it could put you off with a dentist forever, but it was 1976. I'm giving away my age. I was 16 when that movie, and it was called Marathon Man, and it was with Dustin Hoffman and Laurence Olivier. Yeah, I think it put most people, anyone listening to this will know exactly what I'm talking about. The torture scene and so on was horrific. Yeah,
that's one movie I certainly won't be seeing, even if it's black and white. No thanks. It's not going to work.
It was black and white, and scariest movie I've seen.
No wonder that people are so traumatized and have dentophobia and odontophobia and all that kind of stuff.
Yes, odontophobia, that's a good one.
Yes.
So for the people with odontophobia, let's talk about how we fix it with sedation, oral sedation versus conscious sedation.
Could you start, Dr. Yudelman, by explaining to us the main difference between the two?
So one of them, conscious sedation, is IV or intravenous sedation. Oral sedation usually involves taking a pill that helps you relax, but doesn't fully knock you out. Conscious sedation is an IV, which allows you deeper state of relaxation, and it's administered by an anesthetist in our practice with full safety. They bring all their safety. It's as if you're in a hospital. There are dentists that will do IV sedation. I don't even know if it's legal to do it on a patient if you're also the one doing the treatment. I don't think it is legal, but don't quote me on that. We used to do that when I worked in London on Fridays. We used to pull out a vial of Valium and suck it up into a syringe, and all the nervous patients would come in on a Friday, and we'd just stick some in your arm, and we'd just watch until your eyelids got all heavy, and then you'd give a thumbs up and we'd get going. That was the early 80s for you. Now they're very strict in the UK, and all over the world, because obviously you need it to be done by a qualified professional. So if you're listening to this, I hope I didn't scare you, but also if you're listening to this and you heard of a dentist that does do sedation and works on you, just check it out. I don't recommend it. There should be someone monitoring you with all the proper kit. They use an oxygen meter that goes on your finger. They've got all the resuscitation and other drugs there should you get too sedated, and they really know what they're doing. They normally anesthetists that will put people to sleep completely for operations. So for them to do an IV sedation or a conscious sedation is really easy. You're actually awake, but you don't remember anything afterwards. If the dentist says, move your head to the left or open your mouth, you're listening, but you don't remember. So talking about the pill, oral sedation, I usually will prescribe Xanax or Xanor, just a very small dose. And if a person's very nervous and they're not going to sleep the night before, I'll prescribe a few. So they'll take one the night before and then one the morning of the appointment, an hour before they come in. And if you come in and you're still very nervous, you can take a second one in the waiting room. You feel like you can walk and talk and drive. And I often get patients that say to me, oh, that pill you gave me isn't working, but why don't you just go ahead and numb me up and let's get it over with. So that's really funny because, when you saw them for the checkup, they were sweating bullets and now all of a sudden the pill isn't working, but they're ready to do whatever. So
Interesting.
I love that. Yeah.
So, who would you say benefits the most from sedation dentistry? Is it for people with extreme fear, or can it help others too?
Well, I was going to joke, but it's not funny. I was going to say that the dentist benefits because when the patient's very nervous, it makes the dentist very jumpy as well. And, so it's not just for extreme fear. So sedation also helps if you have a strong gag reflex. And, we mentioned something about gag reflex last time. I've had patients with severe gag reflexes, and over time I've studied that and I've looked up at something I've found whenever I ask those patients, have you ever been, dumped by a wave? I think you call it, you would know, you call it like a washing machine when you get tumbled under the water and you feel like you're drowning. So a lot of body surfers and surfers have had that experience if you're near the coast. So that can lead to a severe gag reflex if you felt like you were drowning at any point. People who've actually been assaulted or choked, people who've done martial arts or wrestling, or who've actually choked on a piece of meat and someone had to do the Heimlich. They don't associate that with the dentist. Sometimes that gag reflex comes from being in a situation where it was a fight or flight. You got severe adrenaline. You thought you were dying. You couldn't breathe. And you get this really overreactive subconscious thing. I've never had anyone that's gagging actually vomit. They can start choking and they start pushing you away and lashing out, and it's more just protecting the airway. It's got nothing to do with what's in your stomach. It's nothing to do with the vomiting. It's more so that's where something like Zanol for like a gag reflex can work for people. And a lot of time they get then a second fear, which is fear of vomiting on the dentist, or fear of not, you go in and you manage to get numb, but then fear of having to stop the dentist, which we spoke about last week. That's important to know that you can stop the dentist anytime. For some people, they need multiple complex procedures in one go, or they need things that are unpleasant if you're awake, like if you need 2 or 3 extractions and then you need implants placed. Like me personally, I'm not that scared. I'm a little bit scared of the dentist, to be honest. I have actually found, I was scrambling around looking in drawers and found an expired Zanol and took it before a dental appointment. I was going for a root canal. I've subsequently had root canals and inlays done without sedation, but I don't enjoy the dentist, which is why maybe I'm a little bit kinder to patients that are nervous. But having said that, the reason why I was going down that little rabbit hole is if I needed a tooth out for some reason and then I need an implant placed, I would definitely go for heavy sedation, even conscious sedation with an anesthetist. They can do a colonoscopy, which is where you get a camera up your backside. They can do that while you're wide awake. Apparently it's not painful and it's not pleasant, or apparently people have had it awake and it's not that uncomfortable, but just the thought of that and having to experience that. I've had several colonoscopies. I'm 64 and I was always under conscious sedation. I don't remember any camera going anywhere. So, let's put it that way. So, it's like if there's something that happen that's unpleasant, you don't have to be dreadfully scared to opt for sedation. It can increase the cost of your visit. I believe it's about $3,500 for the first half hour of sedation. That's for the anesthetist to come out and bring all his kit and put the sedation in. And then there's obviously a much smaller cost per extra half hour after that, just for him to sit there and to be there to wake you up, which is important. But yeah, like a 2-hour sedation, if you call OptiSmile, we can tell you what sedation costs. But, if you're getting, two implants placed and 3 crowns, and you're going to be asleep or unconscious for 2.5 hours. It goes so much quicker if you are nervous. Once you're sedated, the dentist can get going and do your treatment really without having to stop all the time and check how you're doing and so on. And it's all about easing the process for patients who might otherwise avoid necessary care. I'm not promoting sedation for everybody. Something we haven't mentioned is happy gas or laughing gas. It was at one time very, very popular. There was a movie, Little Shop of Horrors, that was a comedy, and the dentist was the one taking the gas all the time. When I practiced in Australia, I worked in a practice for a while that used a lot of happy gas, and the place, you could just smell the happy gas, and it's something I don't like to do. There are dentists who use it and it works very well, but because we don't use it at OptiSmile, it's not something I'm talking about, but that's called relative analgesia. And what's nice about that is you put it on over the patient's nose, they breathe it in and out, and it makes them very relaxed. You still got to numb them and everything, but when you're done, you turn up the oxygen, you turn off the nitrous oxide, and it's completely out of their system. They can drive, they can walk, they can talk. If they're going out with their friends, they can have a drink. I believe, I haven't done it in a long time, but I don't know. But that also works well. We just don't do it at OptiSmile for a number of reasons, which I won't go into now.
Okay, but you mentioned that while you are under sedation, obviously your vitals are being monitored as well. So for those who are worried about the safety of it all, how do you ensure a patient remains safe and stable under sedation?
Yeah, so look, patient safety is paramount. Not only us, but the anesthetist will review the medical history, current medications. They'll check your blood pressure. If you have got medical problems, they will always speak to your specialist physician or your cardiologist or your pulmonologist or whoever it is that's looking after you. During the procedure, when I say we monitor vital signs, I mean the anesthetist. Blood pressure, oxygen levels, everything is watched throughout. And having a qualified anesthetist and emergency protocols in place is essential. These are highly qualified. We don't just use any anesthetist. They're special anesthetists that come highly recommended. We've worked at OptiSmile. We've been doing sedation for 10 years, and we've had some anesthetists that the dentists weren't happy with, and we don't invite them back. We've got a number of different anesthetists, and there's even anesthetist services. So if you go to a dentist that doesn't have an anesthetist, they could get on one of their WhatsApp groups and ask other dentists, hey, do you guys know who can come and do sedation? But having said that, not all dentists like to work under sedation. So myself personally, if I have a patient at OptiSmile that wants an anesthetist or needs an anesthetist, it's generally for implants or extractions or root canals. I personally don't do any of those procedures. I do a lot of the cosmetic work and so on. But the other dentists in the practice, the prosthodontists and my other associates, we may be doing 1 or 2 sedations a week for patients, and it's quite common for us to do that. But I personally don't do any work under sedation. I don't. Since the 80s, since my experience with doing sedations myself, I went through the nitrous oxide route for patients, and then after that I use Xanax oral sedation for patients. I don't even like to give patients stronger things like Dormicum or Valium. I like the patients to be awake and responsive and to have that two-way communication. But so, if you put your dentist under pressure to bring an anesthetist in, and the anesthetist comes in and knocks you out, and then the dentists themselves don't have experience working properly under sedation, that might not be such a good thing. That just came to mind. I wasn't planning on saying that, but that's the truth right there, yeah.
And doctor, what does the sedation process look like for someone who's never experienced it before? Could you maybe walk us through the typical steps?
Yeah, so as I mentioned before, oral sedation is really easy. So something like alprazolam, which is Xanax or Xanor. There's some other names for it in South Africa. Alzam, I think they call it. That's a very safe. It's a benzodiazepine, which is a sedative. It's in the sort of Valium and Dormicum family, but it's much shorter acting. It's a very safe sedation. Even if you took 4 of them, which I don't recommend, but we prescribe 0.25 of a milligram, quarter of a milligram. You could take a whole milligram, and as long as you don't have any alcohol, you'll still be walking and talking, but you'll be pretty out of it. You'll be acting like you had a few glasses of champagne, but you might be the life of the party, but you're not gonna make a complete idiot of yourself. You'll still have control. Whereas with something like Dormicum or Valium, it's like a bit of a fine line. A lot of the time, the patients are just falling all over the place, and they can't speak, and they can. Yeah, I don't enjoy that, to be honest. They can be like, they can start falling. Like you were trying to work on them, and then it's almost like they're at the level of like intravenous sedation, and you get to a point where you really need to have monitor the oxygen and have safety equipment around. So taking pills, it's easier, but you got to be careful. If you go to the dentist and he gives you oral sedation and you don't remember a thing, then you are way too deep. You should have an anesthetist there that could reverse it by, you got a drip up and so on. So that takes me to the next step. But yeah, I mean, the main thing for oral sedation is just that you feel relaxed and that it takes the edge off, and it does make things go a bit quicker. The oral sedation, it's just to make you feel relaxed and take the edge off. It's not to knock you out completely. But now for IV sedation, an anesthetist is vital. They set up an IV line at the clinic, an intravenous line. They put a little butterfly near your wrist or in your vein. I'm sure most people have had some kind of anesthetic or sedation before. Yeah, you become calm, semi-drowsy, but you typically remain responsive to instructions, and you still get numb. With any of these things, the dentist still has to numb you up. At OptiSmile, we use the wand. Even if someone is sedated, it's just a more gentle way of numbing people. And with the intravenous sedation, the anesthetist then reverses it and can wake you up in seconds.
Okay. And with oral sedation, how soon before the appointment should the patient take the medication? And also, what restrictions should they follow?
So usually an hour before, we recommend on an empty stomach. That works better. I recommend you wake up, you take your little quarter of a Xanor, you have breakfast, you come on over, you don't drive. You need someone to drive you, just from a legal point of view. With very light sedation, people often feel like they're able to walk and catch a Uber or get on a bus. I tell them, be careful you don't walk into a pole or something. But you're pretty okay. I tell them to avoid any alcohol afterwards, because even though you feel like it's not working, if you go straight after the dentist and you've had a Xanor a couple of hours before, you really shouldn't drink. Benzodiazepines, Valium, Dormicum, Xanor don't mix well with alcohol at all. It's not like 1 and 1 is 2. It's like it multiplies it. So it's really not advised. Yeah, oral sedation is really simple. Like I said earlier, if someone's very nervous, they can take one the night before. And if they feel like it's still not working by the time they get there, they're still very nervous. Or maybe it's a bigger person, the body to dosage, the body weight to the dosage wasn't quite right. They can take another one. If they're really nervous and they take another 2, it doesn't make a big difference. Xanor is a very sort of, it's not going to knock you out or kill you. It's a very easy medication for people to take. I don't prescribe 10 or 20 at a time. I'll usually prescribe 2 or 3. All these benzodiazepines can be addictive. With Xanor, I believe it's much less addictive, whereas if you prescribe Valium or Dormicum for a patient, and then they come in and they did one before and then one after, and they got another appointment, they come back and it's like, oh, I don't know what happened to the rest of the prescription. What happened is the next day they felt like, oh, I really like the feeling of that Valium. And after just 2 or 3 days of being on Valium, you can actually become addicted. It's a very addictive drug. So I don't really like prescribing that for patients. And I'm very careful when I prescribe Zanor that I don't, just for their own protection, that even if they do enjoy that feeling of the Zanor, that they don't have any left, or maybe they only have one, or they keep it for when they go on an aeroplane or something. But yeah, a lot of dentists have gotten into trouble. I believe a lot of these rock stars over the years that have died from overdoses and so on, a lot of the time it's not the doctor, but it was the dentist that was supplying them with their drugs, which is kind of crazy. Yeah.
Wow.
Yeah, they should maybe make a movie about that.
Hectic. Yeah. But I must be honest with you, Dr. Yudelman, conscious sedation sounds a bit more intense. Are patients actually still awake and able to respond, and how quickly do they recover?
The great thing about using an anesthetist that's used to working with dentists is they know that we don't like the patients to be too deeply relaxed, that they keep them like right on the edge where the patient, for all intents and purposes, if you walked into the room, you might not even notice that the patient was sedated. They can even have their eyes open. If you say, put your head to the left, they don't take more than a few seconds to move. You say open, close, bite. They follow instructions. The recovery varies. Sometimes if the patient is not that cooperative, then they'll make them a bit deeper, or depending on the actual procedure. If it's something like an extraction, they'll make them more deeply sedated during the process of the actual extraction. But while they're getting numb, and after the extraction, if they're getting sutures or anything like that, they lighten it. They can adjust it, minute by minute. And then when they turn off the medication and they reverse it, most people within 20 minutes they're up, they're walking, they're smiling, they're always smiling for some reason. We always make sure someone meets them. So as soon as the procedure's finished, the husband or wife or the parent will come into the room, and it literally takes seconds. They like, oh, we're done, and then we don't get them up and walking, right away, but we start cleaning up the room and put everything away. If they had surgery, you don't want them to wake up and there's all these instruments around, and it's kind of scary because, and a lot of the time they don't even remember getting home. It affects your memory a bit, but there's no after effect. It's called retrograde amnesia, I believe, where it actually sort of works in reverse. Yeah, it just sort of knocks out that part of your brain, and so you think you had a wonderful time. So each time you come, it works better and better.
Yeah,
and look, some patients I think enjoy the anesthetist too much. They're done with all their treatment, and then they're like, oh, so when are we doing that other root canal? It's like, no, you're done. They're like, are you sure I don't need any more root canals?
It's that good.
Yeah.
But also for those concerned, Dr. Yudelman, what are the main risks or side effects of sedation, and how are they managed in a dental setting?
Yeah, look, common side effects might be nausea, dizziness, or prolonged drowsiness. Serious complications are rare when all the protocols are followed. We manage this by carefully monitoring the patient and having them rest until it's safe to leave. At OptiSmile, these common side effects are not common. This is common in the literature, or common depending on where you're going. But that's where having a proper dentally trained or an anesthetist that's experienced with working with dentists. So serious complications are rare when all the protocols are followed. We manage these by carefully monitoring the patient and having them rest until it's safe to leave. We always recommend dental experienced anesthetist. one of these anesthetist groups that has people that have worked with a lot of dentists, so they don't put them too deep. They also generally work with doctors that do short, less invasive procedures like colonoscopies and very short procedures. So they're used to keeping people very light. And obviously, the deeper you are, if you're getting close to general anesthetic sedation, then there's more side effects or after effects.
All right, and then for those wondering about feeling groggy or worried about it, feeling out of control perhaps, how do you address these concerns beforehand?
We spend time explaining the process and answering questions. We also assure patients that they will be in a safe, controlled environment with trained professionals. And, that knowledge alone helps to reduce anxiety.
From a cost perspective, is sedation dentistry significantly more expensive? And how should patients plan for that, doctor?
So we did broach that earlier. It does add to the treatment cost because you're paying for the sedationist's time and expertise. In the case of OptiSmile, that's a fully trained anesthetist. I encourage patients to factor it in as a part of their overall treatment plan if they truly need intravenous sedation to proceed. At OptiSmile, when we perform more procedures in one visit, I mentioned about doing a quadrant or doing like an upper and lower left, and then a second visit where we do upper and lower right. Whether you sedate it or not, we often will give patients a 10 or 15% discount on procedures that are done together because it makes it much quicker and less expensive time-wise and material-wise and setup and so on. So that cost saving is passed on to the patient. And in some cases, that might even pay for having the sedationist there, because if you're getting, 2 or 3 crowns or 2 or 3 implants and some extractions, and it's all done in one visit while you're out, say you're out for an hour and a half or 2 hours or something, the savings in doing all that treatment in one rather than coming back for 2 or 3 or 4 appointments, that saving is passed on to the patient. So you come out even in many cases, if not better.
And then finally, if someone's on the fence about sedation, what factors should they consider to decide if it's actually the right choice?
They should consider their anxiety level, the complexity of the procedure, how much they can tolerate in a single session, their medical history, and the detailed chat with a dentist is the key to finding or deciding if sedation is their best route. Oral sedation, it's something you can try. I did get into quite a bit of detail about our preferred method. And I know we always put a disclaimer at the end of every one of our podcasts, but I just want to say myself here that all of this advice, especially when it's now coming to things like sedation and taking drugs and what to prescribe, that's all my own personal experience with, over 42 years of experience on 4 continents and having gone through everything from giving people a jab in the vein with Valium back in London in the day. In the US is when I was using and got more into giving oral sedation like Xanor. In Australia, I was using Xanor, but also nitrous oxide, which we touched on. And we also would have in the practice, not myself, but an anesthetist that would do certain cases. And for very complex things or things that are going to really be done, we haven't even spoken about general anesthetic. So there are cases like if someone needs 4 wisdom teeth out, or you need like a major jaw surgery, we refer you to an oral surgeon, and that's done in the hospital under full general anesthesia, because then you don't need numbing. So they knock you out, they take out your wisdom teeth, they give you painkillers, and then they wake you up. And it's a different type of procedure. We haven't really covered general anesthetic, but that's a completely different thing for things like wisdom teeth. There are dentists that will go and do general anesthetic in the hospital, but the level of equipment and so on for doing fillings and crowns and implants, it's not the same. And because it's not something that we offer at OptiSmile, it's not something that I'm going to cover here. So I hope that all helps.
Dr. Yudelman, thank you so much. Another great and very reassuring podcast of Save Your Money, Save Your Teeth for this week. Looking forward to our next one next week.
Yeah, myself as well. And the last one in the series next week is how to prepare for a stress-free visit. So tune in next week, and looking forward to giving some general tips for people that don't need sedation or don't need intravenous or oral sedation, just how to make your trips less stressful. So your trips to the dentist less stressful. So looking forward to sharing that next week.
And we hope that to you listening, that you're feeling a bit better about dentists now. And as I say, knowledge is wisdom, but and power. But that's it from myself and Dr. Clifford Yudelman today on the podcast Save Your Money, Save Your Teeth. Also remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. And don't forget to subscribe to the podcast for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and also financial savvy. Yeah, that's exactly what you can look forward to in our next podcast. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.